What is the rule of 50% used for in the diagnosis of DORV? A. 50% of the aorta must override the VSD. B. Both great arteries must arise more than 50% from the right ventricle. C. 50% of the cardiac output must be directed to the lungs. D. The VSD must be at least 50% the size of the aortic root. Answer: B. Both great arteries must arise more than 50% from the right ventricle. In DORV with a subaortic VSD, the oxygen saturation in the aorta is typically A. Equal to the oxygen saturation in the left ventricle. B. Equal to the oxygen saturation in the right atrium. C. Lower than the pulmonary artery saturation. D. 100% in all cases. Answer: A. Equal to the oxygen saturation in the left ventricle. Which imaging modality is considered the gold standard for mapping the spatial relationship of a remote VSD to the great arteries for surgical planning? A. Transthoracic echocardiogram. B. Chest X-ray. C. Cardiac CT angiography, 3D reconstruction. D. Electrocardiogram ECG. Answer: C. Cardiac CT angiography, 3D reconstruction. A restrictive VSD in the setting of DORV will most likely lead to A. Cyanosis and low pulmonary blood flow. B. Left ventricular hypertrophy and systemic hypotension. C. Suprasystemic left ventricular pressure. D. Resolution of the heart defect. Answer: C. Suprasystemic left ventricular pressure. Which of the following is a potential complication of the interventricular tunnel repair? A. Left ventricular outflow tract obstruction, LVOT. B. Right ventricular hypoplasia. C. Persistent patent ductus arteriosus. D. Paradoxical embolism. Answer: A. Left ventricular outflow tract obstruction, LVOT. In the context of DORV, what does bilateral conus refer to? A. Two pulmonary arteries. B. Subinfundibular stenosis in both ventricles. C. Presence of muscular infundibular tissue beneath both the aortic and pulmonary valves. D. Dilation of both atrial appendages. Answer: C. Presence of muscular infundibular tissue beneath both the aortic and pulmonary valves. A patient with DORV and TGA-type physiology, Taussig-Bing, will show which pattern on an arterial blood gas? A. Normal P2 and PCO2. B. High P2 in the pulmonary artery and low P2 in the aorta. C. Low P2 in the pulmonary artery and high P2 in the aorta. D. High P2 in both the aorta and pulmonary artery. Answer: B. High P2 in the pulmonary artery and low P2 in the aorta. What is the significance of the mitral to pulmonary distance in surgical planning for Taussig-Bing DORV? A. It determines the risk of mitral valve prolapse. B. It dictates whether an arterial switch or a Damas-K-Stansel procedure is needed. C. It assesses the likelihood of heart block. D. It is used to measure the size of the left atrium. Answer: B. It dictates whether an arterial switch or a Damas-K-Stansel procedure is needed. Which ECG finding is commonly associated with DORV? A. Left axis deviation and right ventricular hypertrophy, RVH. B. Isolated left bundle branch block. C. Short PR interval. D. Persistent sinus bradycardia. Answer: A. Left axis deviation and right ventricular hypertrophy, RVH. The Rostelli procedure is specifically indicated for DORV cases with A. Subaortic VSD and pulmonary stenosis. B. Remote VSD and no pulmonary stenosis. C. Subpulmonic VSD and coarctation. D. Doubly committed VSD and mitral atresia. Answer: A. Subaortic VSD and pulmonary stenosis. Which embryological process is primarily disturbed in the development of DORV? A. Formation of the primary atrial septum. B. Rotation and septation of the conotruncal swellings. C. Development of the endocardial cushions. D. Sprouting of the branchial arch arteries. Answer: B. Rotation and septation of the conotruncal swellings. Heterotaxy syndromes, like asplenia or polysplenia, are most commonly associated with which VSD type in DORV? A. Subaortic. B. Subpulmonic. C. Non-committed, remote. D. Doubly committed. Answer: C. Non-committed, remote. What is the most common cause of early postoperative mortality after DORV repair? A. Pulmonary hypertension/hypertensive crisis. B. Renal failure. C. Complete heart block. D. Residual VSD shunt. Answer: A. Pulmonary hypertension/hypertensive crisis. In a double outlet right ventricle with intact ventricular septum, how does blood exit the left ventricle? A. Through the aorta. B. Through the pulmonary artery. C. Through a patent foramen ovale or ASD. D. Through a persistent left superior vena cava. Answer: C. Through a patent foramen ovale or ASD. Long-term follow-up of DORV patients who underwent interventricular tunnel repair focuses primarily on monitoring for A. Recurrent coarctation. B. Development of subaortic stenosis or baffle leaks. C. Liver cirrhosis. D. Early onset of coronary artery disease. Answer: B. Development of subaortic stenosis or baffle leaks.